Hey guys, Davin Lim, dermatologist. Today we'll be talking about microneedling, but importantly, the depth of microneedling, because this dictates the success of microneedling, but importantly as well, the safety. So how deep you go is very important, both for results, but also to mitigate or reduce the side effects from this popular treatment. So let's talk about microneedling in general. What is it? How do we do it? What devices can we do? And what it's used for? So microneedling is an old treatment, first used, believe it not by tattooists, right? Because tattooists used to use their tattoo gun, which consists of needles. And what they used to do was to use their needle gun without any ink. And as a result, they can needle over tattoo and cause what's known as transepidermal exfoliation. In other words, removal of the ink by tattooing and microneedling. And this has been done by tattooists far before dermatologists use it for microneedling. So they've been using this for 4 to 5 decades, just using a tattoo gun with needles. They've got no ink to exfoliate pigment itself. So those are the history of microneedling. But since then, microneedling has come a long way. You can buy lots of stuff online, and there are many different clinics that offer it, including aestheticians, dermatologists, cosmetic physicians, and plastic surgeons. So the different tools you can use include a safe one, such as a Derma stamper or stamping mechanism. You can also use what's known as a roller, which is a skin roller or skin microneedling rolling system. The third thing you can use is a pen. So we call those either the skin pen or a Dermapen. And these pens use a motorized unit to drive the different needles at different depths. So those are the 3 ways you can microneedle. So what is microneedling used for? It can be used for various things, including treatments of superficial scars, right? So acne scars, chickenpox scars, surgical scars, traumatic scars. It can also be used to improve your skin texture. We can treat fine lines, also some pigmentation, and the pigmentation may be melasma pigmentation and also deeper pigmentation as well. And it can improve skin texture, skin tone, and importantly, microneedling can deliver what's known as topical agents. So topical agents are things like your creams and your serums, whether it be ascorbic acid, your retinol, your arbutin, or any one of your pigment inhibitors. So these are the main goals of microneedling. It's important to understand the depth because, like I said, the depth dictates your efficacy and also safety. So generally, using a rolling mechanism, you should limit your depths to around 0.25. The reason being is that if you use needles and you're not very careful, the rolling mechanism itself may cause too much collateral damage because of the actual rolling mechanism of the needles itself. So in my opinion, needles, it's on the roller system, limit it to 0.2, 0.3 at most. Hey guys, I hope you're enjoying that video. Now a little word from our sponsors. Sleeping on your back is generally considered the best position after microneedling or any other cosmetic treatment for that matter. This position minimizes pressure on the treated areas and therefore reduces the risk of irritation and disrupting the healing process. It also helps to prevent rubbing or friction against the pillow, which could potentially lead to sleep wrinkles, discomfort, or even infection after treatments. But if you're like me and prefer to sleep on your side, it can be difficult to avoid pressing your face directly onto the pillow. This is why I use the Omnia pillow from Sleep & Glow. It has a unique 3D design that provides comfort whilst reducing contact between the face and the pillow. Its 3-dimensional design supports the upper and mid-face area, reducing compressive forces on your face while sleeping every night. This in turn reduces wrinkling and friction during my sleep, as it is mechanical compression that leads to sleep wrinkles and not dynamic wrinkles. Here's how it works in more detail. This is me on a normal pillow. Notice the compression of my mid-face and forehead area. It's normal biomechanics associated with sleeping. The compressive forces act on the perpendicular vector to the expression lines. This is the Omnia pillow from Sleep & Glow. Notice how the face is cradled and supported. The side cradles of the pillow help minimize the skin twisting and folding. There's no compression, which means there's no disrupting treatments from healing. And there's no sleep wrinkles and no morning puffiness. Moreover, this pillow has an orthopedic effect. This ensures correct anatomical position during your sleep. It's also gratifying to know that my positive outcomes are not unique. Sleep and Glow efficacy is also clinically proven. Sleep and Glow conducted a clinical study in a dermatological setting in Barcelona. In 82% of cases, sleep wrinkles are reduced after 3 months of sleeping on this pillow. If you'd like to learn more, I will put a link in the description below, as well as a code, so you can get 30% off your second pillow. Now, you can look at microneedling from a different perspective and figure out where the pathology is. So as dermatologists, we'll look histologically under the microscope and understand the layers of skin. So for example, if you're treating scars, you might want to go a little bit deeper. And the safety may be up to 2 millimeters deep, especially when you're doing it at home. You might want to go 1.5 to 2 millimeters, providing you can tolerate the pain. Right? Because scars in general lie in the deeper layers of skin, not the upper layers of the epidermis, but the deeper layers known as the dermis. So it can lie in the superficial dermis, the mid-dermis, or the lower dermis. That gets tricky because it often needs a little bit of clinical correlation and skill sets to figure out where the scars are. So for scars, generally speaking, you go deeper. Let's talk about another condition such as wrinkling. So if you have fine lines and wrinkles, you can microneedle at different depths. You can do it superficially, medium, or deep. We won't talk about deep because from a safety perspective at home, it's probably not advocated. From a superficial to medium depth, you can use it very superficially, somewhere around 0.2, 0.3 mils. And when you use it at that depth, you want to increase the permeability of certain topicals, in other words, your creams and your serums, which may add to your skin rejuvenation. So when you're using that, you can use things like stampers, you can use your Dermapen or microneedling device, or you can use your rollers, but limit it to 0.2, 0.3 mils. And you can use your serums for that to help increase the absorption and hence stimulate collagen. And the serums you might want to use include things like ascorbic acid, vitamin C, or even retinol or retinoid to help increase your collagen production. Now, if you want to go deeper, that's up to you. But generally speaking, most dermatologists try to advise patients not to go too deep when it comes to home use devices, because certainly it can help, but you're at risk of causing idiosyncratic scarring, in other words, scarring due to the device itself, bleeding, and certainly infection. So, when it comes to treating pigmentation, and this is what the video is about, when it comes to treating pigmentation, especially for melasma pigment, we don't want to go too deep. So the aim of microneedling when it comes to pigment is to increase the absorption of topicals. So the topicals that are most favored include vitamin C or ascorbic acid, and for this you only need to go between 0.1 to 0.2 mil, because what we want for microneedling in this instance is to disrupt what's known as the stratum corneum and the epidermis, the upper layers of skin, to increase the absorption of the topicals itself. So in that context, go superficial. When you go too deep, you run the risk of worsening your pigmentation, giving your skin irritation, and in some cases even scarring. So guys, this is a simple guide to microneedling to give you guys an idea about the safety and depths of various treatments. Hope you enjoyed that video.